Adam, thank you. So listen to this. According to state data, Hispanic Washingtonians are far more likely to be infected with COVID-19, but they are also far less likely to have gotten a vaccine. This despite calls for racial equity in the COVID response. Health officials say the systems in place are perpetuating long existing problems, putting minority communities at greater risk during the pandemic. In our state, Hispanics are the most affected. They make up around 13% of the state's population, but 32% of the state's cases. To date, they've received just about 5% of the vaccine doses, far less than their share of the population. So our guest this morning to talk more about this, Dr. Julie Morita, Executive Vice President for the Robert Wood Johnson Foundation. She just testified before Congress, had an op-ed published in USA Today on the need for equity in vaccine distribution. Dr. Morita, thank you so much for being with us. Good morning.
Morning, Liz. Thanks for having me.
So let's get right to it here. We just saw the numbers here in Washington. We just showed those on the screen. People of Hispanic origin are disadvantaged when it comes to getting a vaccine. What can we do now to make this distribution more equitable?
Yeah, I think the COVID has really made clear that there are certain groups who are disproportionately impacted by the disease, more likely to end up in the hospital, more likely to die. And in Washington, it's Latino Americans who are actually disproportionately affected. When you look across the nation, it's Black Americans, it's also Native Americans who have been affected as well. What we want to see, what we need to see is actually that the vaccination efforts and the vaccines are actually ending up in their arms as well. And we're not seeing that necessarily throughout the nation. What's incredible is the level of data that you all have in Washington, that you're able to report rates of disease by race and ethnicity, that you're able to report vaccination by race and ethnicity. That's not happening in other parts of the country, and that is sorely needed. But now that you know, it's really important to make sure that we get those vaccines into the Latino Americans' arms so they can actually be protected and not suffer a disproportionate impact as this pandemic rolls on.
So talk a little bit about that, because I mean, you mentioned, we've got to get those vaccines into arms. Our analysis here at Q13 showing locally where leaders are trying to target higher minority areas, people are still less likely to get the vaccine. Why do you think this is happening?
Well, I think it's important. It's not enough to just actually locate a site in a community where we know there are a lot of Latino Americans. It's not enough to just locate the site there, because the questions we have to ask is, are those sites open after hours on weekends, and are they accessible? Because people may not be able to take time off from work and may not be able to get there because they don't have a car. So it's got to be more than just the location itself. Do people have to have high-speed internet and multiple devices to actually schedule their appointments? Are there phone systems that actually allow people to call and schedule their appointments? Are materials and information available in multiple languages so that people's questions can be answered and they're getting the kind of information that they actually need? All those things need to be in place to make sure that people have equitable access. It's not just enough to just locate a site in the community.
Yeah, that's so true. We've talked about that, especially when it comes to sign-up forms being mostly in English, people not having the proper transportation. What can community partners do? Say faith leaders, community organizers, maybe to help encourage some of this vaccination and get it to the people who need it most?
So prior to my time at the foundation, I was actually in public health in Chicago for many, many years and was responsible for the H1N1 vaccine distribution program there. And what we learned there was that in order to actually help people get information, we need to get it to the community from trusted sources. And that would be community organizations, faith organizations in some communities. And having that interaction and that engagement is critical, because not only is it information sharing, it's also understanding and hearing from communities. What are their questions? What are the concerns? What information do they need to feel comfortable and confident in the vaccine and to have trust in the vaccine, so that when the vaccine is available, they're ready to roll up their sleeves and get it. So that kind of engagement with community and faith organizations is essential.
Yeah, it sounds like it's definitely going to take a village. Dr. Morita, thank you so much for being with us. Valuable information. We appreciate it.
Thank you.